When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Gore Show. Today we're talking about interventional radiology. And people ask, what's that? Are they a physician? What kind of doctor they are? Are they radiologists? Are they surgeons? So it's kind of mix of everything. And to talk about this very interesting specialty and how they help patients and other fellow physicians to take care of the patients, we have Dr. Hitem Malde to the show. Welcome to Dr. Gore Show, Dr. Malde.
Thank you, Dr. Gore. Thanks for having me.
Anytime. So Dr. Malde did his training from University of Bombay in India in radiology. Then he came to United States where he did his training at Valhalla, Westchester Medical Center. And then he went on to Cleveland Clinic to do his fellowship in interventional radiology. So we are very privileged to have Dr. Malde on the show. So Dr. Malde, interventional radiology, especially patients don't know what kind of work and how you help them, and only few select people who needed the help kind of know your branch. So what does an interventional radiologist do which is not done by a regular radiologist?
Thank you again for that kind introduction. Most radiologists usually spend the majority of their time reading scans, CAT scans, ultrasounds, MRI, X-rays. Interventional radiology is a branch of radiology,
right,
where the doctors use all these technologies in a minimally invasive fashion, both for diagnosis and also to help treat patients in certain situations.
Okay.
Here's a patient who presented to the emergency room with cough, fever, chest pain, had a chest x-ray as part of his routine workup, and that showed what looks like a spot, or in medical terms, a mass in the chest.
Right.
Unfortunately, a pneumonia can look very similar.
Correct.
And it's very hard to differentiate the two. The treatments are very different.
Right.
Here comes the interventional radiologist. He biopsies the spot using the CAT scan machine to guide the needle placement, and we have a diagnosis of lung cancer. That helps the clinician to further manage the patient and tailor the treatment.
And is there any other area that you can help us in the similar way?
Absolutely. Let me show you a few other examples.
Right.
Next slide, please. Here's a patient who came to the emergency room with the worst headache of his life.
Okay.
And his scans showed bleeding in his brain.
Right.
The doctors thought maybe he could have a cerebral aneurysm, which is a very deadly condition,
correct,
as you know. The interventional radiologist may be asked to perform an angiogram on this patient.
Right.
And here we have an angiogram that shows the aneurysm.
Right.
Although modern CT scans and MR scans can show the same thing, but before making any decision as far as treatment, these kind of procedures are very necessary.
Correct, and helpful.
They're helpful, they help the neurosurgeons plan treatment.
Depending upon the location also, right, the symptoms and stuff. So I think you give them so much other information about the collateral circulation. So
absolutely.
Aneurysm is dilatation of the big blood vessels in the brain, and when it dilates, sometimes it can rupture and you can have bleed and a stroke, or some young people sometimes can have just dilatation and pressure and constant headaches.
Absolutely.
And so by doing this testing, the physician knows where the source of this headache and pain is coming.
Absolutely.
And they can make the right treatment,
yes,
where to go, where to stop that bleeder or the aneurysm.
Absolutely. In a similar fashion, patients who come with bleeding from stools, or what we call gastrointestinal bleeding,
correct,
the interventional radiologist may be asked to perform a procedure to find the source of the bleeding.
Right.
Usually they start off, the patients are first seen by the endoscopist, and they try to figure out where the bleeding is coming from, and they try to stop the bleeding using the endoscope, but
Correct.
sometimes they're not able to achieve that.
Right.
And so the interventional radiologist may be asked to perform an angiogram
Right.
and try and find out where the bleeding vessel is, and they can actually take it a step further by try and stop the bleeding from the vessel by plugging up the vessel.
Right. Right. So when there's a bleeding, especially gastrointestinal, can be your ulcers bleeding, or can be a big vessels which was in the base of the ulcer which started bleeding. And if the ulcer is superficial, as Dr. Malde said, the gastroenterologist sometimes can help and stop the bleeder. But sometimes the source of the bleeding is very, there's so much blood inside, they try to take it out, but then it fills again, so they won't be able to see it.
Absolutely.
While you guys can show them exactly where that source of bleeding is, and not only diagnose, but also help by clogging that blood vessel, that small tube, and stopping the bleeding in that area. So these are so many different areas that your help can be such a valuable thing.
Absolutely. Let me show you another example, which is a very commonly performed procedure in any hospital setting. Here's a young child who had an abdominal surgery, and unfortunately after the surgery she developed what looks like a infected fluid collection. Correct. The medical term for that would be an abscess.
Right.
In the olden days, she would have to undergo another major operation to treat this condition. However, with modern techniques and with the help of minimally invasive procedures that are done by the interventional radiology team, next slide please, we can place small tubes or catheters right into this collection and drain this collection or suck out all the fluid, and that can save the patient a major operation. Right. And the recovery time from these procedures is very small. Correct. So it's extremely helpful in many hospital and non-hospital situations.
Right. So abscesses are a collection of pus and fluid inside any cavity, and as Dr. Malde mentioned, it's usually we find it post-operatively, but sometimes in women's condition they can have a pelvic inflammatory diseases and can make abscesses. And those abscesses in old times we had to open and drain them. But also even though we give IV antibiotics, because most people will say, why don't you give antibiotics and why doesn't it get better? It won't get better because sometimes there's so much of pus inside, there's not much blood going. Even if you treat it with IV antibiotics, the antibiotic is not reaching it. And that's why we need that pus to come out. And as a surgeon, I know we had to do a lot of surgeries to take out those abscesses. And what happens, those are very technically difficult surgeries because it's very vascular, there's so much adhesion, there's scarring, and they can bleed a lot as well. So having a friend in your radiology department always helps because it's so easy to put that needle and drain it. And as you rightly mentioned, it's a simple procedure. There's not a big recovery. Patients sometimes go home next day because their fever then subsides. They are getting much better. They're eating better.
Yes.
The pain is less, and it's kind of like a miracle. In 24 hours, you see them turning around.
Yes.
So that's a very commonly performed procedures in hospital settings.
Yes, absolutely. Another area where the interventional radiologist can be very helpful is in women with fibroids. And as you know, it's a very common condition and often treated by the gynecologist first. But in certain situations, the interventional radiology team can play a very helpful and important role in treating certain patients with fibroids. Right. Let me show you a good example. Here's a patient who had a large uterus with multiple fibroids, as you can see. This is an MRI of her pelvis. And she had excessive bleeding and significant pain every time she was having her periods. Correct. And she was referred to us for treatment options. Right. And this is what is offered in many hospitals now. Sure. The interventional radiologist would perform what we call as a uterine artery embolization. Right. What they would do is, in a very minimally invasive fashion, they would make a small incision the size of a pinhole in her groin area. Correct. Pass the small catheter, just like any angiography. Correct. And then
for the cardiac
for the cardiac patients, exactly. It's very similar.
Right.
And instead of going into the heart, they would go into the blood vessels that supply the uterus and the fibroids, and they would stop the bleeding or stop the blood going to the fibroids. And over time, the fibroids would shrink.
Right.
The procedure is done as an outpatient.
Right.
It usually takes about an hour. Can I have the next slide, please? And the patients oftentimes are admitted just for observation periods, for pain management for a day, and they go home the next day, and the recovery time is very quick. Usually they are back to their normal activities within a week.
Right.
Here's an example of such a procedure where, as you can see, the interventional radiologist has placed a small catheter
Right.
from the groin area into the uterine artery, and then once we select the uterine artery, we block the blood supply by using small particles, and there are special materials that are used to achieve the goal.
So the black tube-like thing is the blood vessel which is supplying the blood, and you're going to put a small blockage artificially that the blood doesn't go to this area of fibroids and uterus. And what happens if there's no blood going, there's no growth, and it undergoes shrinkage by avascular necrosis. You're cutting off the blood and it stops growing, and then it kind of shrinks.
Right.
So that's the idea behind. So not only does interventional radiologists help us by diagnosing things, but by therapeutically treating those things as well. Now, all these procedures requires you to be kind of like a surgeon as well.
Yes.
So you're wearing two hats here, right? Not only are you diagnosing with your x-rays and MRI, but you're doing more procedures. So that requires a good amount of training and skills and going to the right person who's done these procedures.
Right. Most interventional radiologists, they, at least the way it is set up in the U.S. now, they start off by doing a radiology residency.
Right.
So they have a good background of imaging techniques.
Sure.
And then they branch out and spend a year or 2 years doing a fellowship, which is tailored in interventional radiology.
Right.
And that helps them, teaches them all these special procedures and how to manage all kinds of situations that they may encounter, either in an outpatient setting or more often in a hospital setting.
Correct. Because a lot of things, as we mentioned, I think they come to the hospitals, and I think so your practice is usually hospital-based, where people refer you patients and you give them the right kind of diagnosis and the treatment. So it's a very innovative field of radiology, and we're going to take a short break, and we'll be right back to talk more in detail about interventional radiology and how can they help patients and physicians manage their patients. We're going to take a short break.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back to Dr. Ghosh Show. So today we're talking about a very unique branch of interventional radiology. These are the radiologists who do procedures to help diagnose and manage patients. So, so in cancer setting too, you guys can help physicians manage the patients?
Absolutely. So as you rightly mentioned, most patients with cancer are usually treated either by the oncologist, with either chemotherapy or radiation therapy, or sometimes there are oncosurgeons who do perform oncologic surgeries, and that's the mainstay of treatment. However, some patients are either not able to tolerate those treatments, or they may not respond well to those treatments, and that's the kind of situation where they may ask us to see what we have to offer. Can we help them out? And the interventional radiologist will use these minimally invasive techniques that we just spoke about to perform a variety of procedures. Let me just give you an example. So here you have a patient who has a large mass in his liver, as you can see, and unfortunately he was not a surgical candidate. And they asked us to help out with this patient. And we decided to do chemoembolization. It's a kind of procedure where you would put a small catheter, just like we did in the other patient with the fibroids.
Right.
And instead of putting the catheter into the uterus, this time we would actually try and select the blood vessels that supply this tumor from the liver. And once we are in those blood vessels, next slide, please.
So you're targeting the blood vessel, feeding the cancer tumor.
Absolutely. We would actually inject chemotherapy right into that area of the liver that has a tumor. And the advantage of that is that sometimes this may have a better effect on the tumor because
you're targeting the tumor without the side effects.
Absolutely. There are very few side effects, so you're limiting the side effects or the systemic toxicity of the chemotherapy.
Right.
And nowadays we are using the same techniques to actually inject small particles or microspheres which have radiation beads in them. So you're giving radiation therapy to these kind of tumors locally in the liver itself without subjecting the patient to excessive radiation which may affect other parts of their body.
This is applied to the other areas of cancer, or it's mainly for liver right now?
No, it is now also being done in patients who have lung tumors, bone tumors, and what we are doing in addition to doing these chemoembolizations and embolizations that I mentioned, we can also, just like we do the biopsies, we have special probes that we can insert into these tumors using CAT scans and ultrasounds. And these special probes can deliver very high amounts of heat locally to these tumors and actually fry the tumor cells, just to use a lay term. And the medical term for that is radiofrequency ablation. And that is also a commonly performed procedure and that can help cancer patients in various situations.
And you know, as you're talking, and I think it's amazing where medicine has gone.
Absolutely.
So apart from there's not a big scar on the thing, there's less side effect, but also you're not making it a different staging too, because when we do surgery, we contaminating the other areas and stuff, so you're limiting your cancer cells in a very limited area.
Absolutely.
And I think that's a great thing, because you kind of not, however good surgeon you are, when you're trying to open up somebody and when you're trying to take the tumor, there's always a scare that you're spreading the tumor as you're taking it out. But here you're not affecting the anatomy or the capsule. You're keeping it very localized. So I think that's a great advantage of doing this.
Yeah, and we have the benefit of being able to use the CAT scans and ultrasound machines to target just precisely the lesion that we need to treat and avoid the structures around it, essentially.
Because sometimes it can grow in a very difficult area next to a blood vessel or behind, the important structure, say kidney and the ureter. So this has a very important aspect of treatment. So it's very interesting to me as well. Now, can you use it for pain? As you were mentioning, you can use it for different areas. If somebody has a back pain and stuff, you think you can apply your techniques to this patient?
Absolutely. Let me show you a few examples. We are asked by a variety of doctors to help deal with patients who have chronic pain or who need chronic medications. One of the things that we do, and this is in cancer patients, next slide please, is we put these ports that can, they can use them to give chemotherapy or pain medications as frequently as they want, and they don't have to get stuck every time they need medications. Next slide, please.
So these are for the patients with the bone metastasis with cancer.
Absolutely. Lung mets, liver mets, all kinds of mets. And here's an example of a patient who has no cancer. He just has hip pain because of arthritis. And the patient was not keen to undergo surgery. And so they often get referred to us as well as to pain management specialists to help alleviate the pain in these patients. And what the radiologist will do is, as you can see, we use fluoroscopy or a form of x-rays to help put a small needle into the hip joint. Once we know we are in the right spot, we'll inject some medication, and usually this procedure takes 15 to 30 minutes at the most. Patient comes in, has the procedure, and goes walking back home. There's no recovery time involved, essentially. And oftentimes it provides pain relief for 3 to 6 months, and that's usually sufficient for them. And if they need to come back, they usually schedule another appointment for a similar procedure, in 3 to 6 months.
Right.
And this can be applied not just to the hip joint, to many joints wherever the patient is experiencing, arthritis or chronic pain. And we do this in adults as well as in kids who have rheumatoid arthritis, which is for juvenile rheumatoid arthritis, which is not common, fortunately, but you may see that in a setting of a pediatric hospital very often.
And also, it can be very disabilitating for the kid who wants to run around and pain.
Absolutely.
And I think this might be a great relief for their pain and their activity levels.
Absolutely.
Now, we've covered a lot of areas. Is there like patients with dialysis or patients with, say, deep vein thrombosis? Like, there's so many areas I think your specialty can go.
Absolutely.
So, is there any other area that we don't know you can help us with?
Yeah, let me show you a few other examples of what kind of things that we do in different situations.
Right.
And sometimes they are customized to the patient and his or her problems.
Correct.
So another thing that we sometimes come across is older patients who have osteoporosis and back pain and have fractures that can be quite painful.
Correct.
They usually get pain medications and rehab and that may or may not relieve their pain, but if the pain is persistent, they get referred to us to help out these patients. Next slide, please. Here's an example of somebody who has a fracture in her spine.
Right.
And as you can see where the arrow is pointing towards the fractured vertebral body.
Right.
And the patient had persistent pain despite being treated for a few weeks. And the interventional radiologist, next slide please, will actually use the X-ray machine or fluoroscopy to place special needles into this vertebral body and inject cement. Right. And the purpose is to, number one, help relieve pain and stabilize the spine.
Right.
And the patient, this is a procedure that takes an hour at the most and is done just through minimally invasive with small incisions, very small incisions.
Right.
There are no sutures necessary for these incisions.
Correct.
You just put Band-Aids on these incisions. The patient actually just is observed for a very brief period of time after the procedure, and they go home in a few hours.
Compared to a major spine surgery that they might need it.
Absolutely.
But also by injecting all this stuff, even somebody who has back pains and stuff like that, the side effects of pain medication, the limitation, you get, you a little bit dizzy, you a little bit, sedated, and it doesn't help somebody who has to be functional.
Yep.
And I think that's a great thing to do rather than being addicted on painkillers.
Absolutely.
And the side effects, this can help a lot of patients with their
absolutely.
pain.
Another important setting or frequent setting where we are asked to help out is in patients who are on long-term, have kidney failure and have dialysis needs. And the interventional radiologist can help place special catheters that help these patients get their dialysis frequently. And they also often get referred to us because when they have fistulas or grafts placed by the surgeons, if they are having issues with those grafts, then the surgeon will ask us to do what we call an angiogram or a fistulogram. It's like an angiogram of these grafts to find out where is the problem and can it be fixed? Can you help this patient out? So let me show you another example of such a, next slide please. Here's a patient who was who has a dialysis graft in her arm, and as you can see, there's an area of blockage where in the middle of the graft, and that was preventing her from getting her adequate dialysis. And this is a very frequent problem that we are asked to help out with. And what we would do is put a small balloon to try and open up the blockage. Next slide, please.
And that small area which is blocked, you opened it up.
Absolutely. And again, this is an outpatient procedure. Patient comes in, has the procedure, which usually takes about 30 to 45 minutes. Patient has a tiny Band-Aid at the end of the procedure. And they go for their dialysis right after the procedure. So it is extremely helpful for these patients because these kind of minor procedures help to prolong the longevity of the graft. And they can keep using the graft for much longer than they would have otherwise been able to use.
So the dialysis patient usually gets this grafts by a vascular surgeon because they need a big vein to access to take out the blood, to wash it through this machine and take out the toxins and get the blood back in. And those grafts are artificially created, dilated veins, and as Dr. Malde said, sometimes they can get blocked, and rather than do a major surgery again to make a second graft, this can prolong and dilate and help them keep doing dialysis. So that's a very this impacts their lives in a greater thing, because dialysis patients need this daily.
Yes.
So I think that's a very good area. Now, when people get blood clots in their veins and arteries, it's similar to this kind of blockage.
Absolutely.
Now,
Absolutely.
you help those patients as well?
Oftentimes these patients, they will get blood thinners,
Right.
and that's all that's necessary. But sometimes the patients cannot get blood thinners because they have tumors in their body that can
Right.
potentially bleed from the blood thinners, or they may have allergies to these blood thinners, and we are asked to help out in that situation. And what we do is we place filters. They're called IVC filters.
Correct.
And it's like an umbrella that
Right.
traps these clots and prevents them from going to the lungs. As you well know, these clots may start in the legs,
Correct.
but it's when they go to the lungs, that's when
can be
they can
fatal.
potentially kill the patient, because the patient may not be able to breathe.
Correct.
And the interventional radiologist will put a small umbrella. I can show you an example. Can I have the next slide, please? Here is a procedure that's going on, and the interventional radiologist is actually just doing a IVC gram or a cavogram. It's a procedure where they actually visualize the blood vessel that they have to place the umbrella in to make sure everything is looking right before they do the procedure. Next slide, please. And here's the umbrella or the
Right.
filter that would help trap these clots from the legs and
Right.
prevent them from going to the lungs through that big vessel that you just observed.
Correct.
And again, this procedure takes less than an hour.
Right.
It's done in a very minimally invasive fashion with a small incision that needs no stitches, and the patient can tremendously benefit from these kind of minor procedures.
Right. To talk about this field that you might not know them as a specialist, because this is usually done by referral. A physician refers their patients to the specialist to take care of individual treatment, and they not only help with their radiology background to diagnose, but with their special fellowship training to take care of the issues. And most of the stuff, as we discussed, is done through small incisions, through small scars. And I've done so many talks about minimally invasive stuff. Be any area of medicine, it's always better than big cuts. So thank you for enlightening us, and till next time,
My pleasure.
have a good day and good night.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.